Nursing homes across the country have been hit really hard with CV, and the problem is growing. And now you got a situation with many of the elderly with pre existing conditions, people that really haven't come out to the public to even get this. In many cases, these are probably visitors or nursing staff at the facility that brought this into them. Because it's not like, these elderly people, once they're in these nursing homes and living centers and apartments that they live in, they don't really get to go anywhere much. So, that being said, there is a video that came out from the Washington Post. This is a doctor appealing for help, and and you're hearing a lot of the same things. They don't really know what to do, you know because we know there's no treatment or cure for this thing. Okay, let's see if I can volume up.
Palliative medicine physician in Western Pennsylvania area. We're a group of about 10 physicians and 20 or 25 nurse practitioners, as well as pharmacists, nurses, and support staff. And all we do is take care of the elderly. In all of our nursing homes, we have a variety of patients with low-grade fevers, cough, congestion, shortness of breath, runny nose, sore throat. And it's creating a real challenge because these are concerns for coronavirus, but they're also concerns and symptoms of the common cold and influenza. And the issue is that the Department of Health and that our local hospital systems have such a limited supply of coronavirus testing. As of a couple of days ago, we could not get these tests done on anyone. And it's been a real challenge because we don't know how to treat these patients if we can't get testing. We need an astronomical amount of tests, and we need them today. Secondly, we need protective masks, regular masks, and we need N95 masks. We need more gloves. We need more gowns. I worry about our workforce because what's going to happen when the COVID infection comes into nursing homes and nurses' aides and nurses and doctors are exposed and they are no longer able to go into the homes to care for these patients. We're going to run into a critical shortage of frontline workers. The question is, what happens if we don't act now? And I pause for a minute because it's scary. What happens if we don't act now and the coronavirus comes into nursing homes across our state and across our country? What we're going to see is massive mortality. We're going to see deaths at rates that we're not used to seeing. We're going to find our hospital beds overfilled. And we're not going to know where to place these patients safely. And it's going to be a real tragedy. You need to put seniors who are at the most risk and the most vulnerable, our greatest generation, our loved ones who gave to us, we need to put them at the forefront, and we need to take care of them better.
That's really true, you know and when you really look at this, it's not just the seniors. I was looking at another article before I even did this video, and it was saying 38 inmates at Rikers Island tested positive for CV. In those closed in situations, even nursing homes are very closed in, it's dangerous. Now you got a situation that can easily be deadly. And I mean, who knows who brought it in to the prison? It could have been another inmate they just brought in. It could have been staff, a CO, that went in there and infected, those inmates. You just don't know. But it creates a really bad situation because that's like an incubator where the virus can grow and spread, and it can really do a lot of harm and damage to these populations that are closed in. Easy, you know? And you're not even talking about the mental health facilities around the country that are also at risk. But, ladies and gentlemen, please tell me what you think. Old people are very vulnerable. A lot of times when they reach up and they're 70s, 80s, and 90s, which is the norm in these nursing homes. They have all kinds of health conditions and all kinds of problems and inflictions of their bodies at, when they get old. And, I just couldn't get over the brother that was sick with CV, and he had a fever for 2 weeks. That is almost unheard of. But we are in a whole different time and place in this country now. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.